Hi. Hi everyone. So again, logistic regression. Again, I apologize for the extraordinarily poor quality of the video, but hopefully it's just the audio explanation, and the video is just to kind of point you which slides I'm talking about. And I apologize for any background noise that might take place because I'm just doing this in my dining room. Okay, so logistic regression builds on the concepts of regression that I talked about in the last video. The difference between multivariate regression and logistic regression is that in logistic regression, we're going to model a binary variable. With the multivariate regression, one thing I don't think I pointed out is that we need to be able to assume that the data follow a normal distribution in order for that multivariate regression to work. And when we have a binary variable, we know that that does not follow a normal distribution, so we need to account for that using logistic regression. So here's an example of a binary outcome, yes or no, the patient will become anemic. And we have different covariates that might explain that: the type of cancer, the type of chemotherapy, metastases, red blood cell count at baseline. We have all of these covariates that may explain the anemia that we want to account for in the regression. We want to be able to determine not only whether or not those factors explain the anemia, but how much, and we can do that with logistic regression. So the key to logistic regression is that it provides odds ratios. Actually, the regression itself provides log odds ratios, but we can easily convert them into odds ratios. So we have a positive response, and that's a statistical language to mean the outcome that we're interested in. Anemia is not positive for the patient, but that's the response that we're interested in. We want to compare two treatments on anemia prevention, and we have some additional covariates that may explain that anemia. So in this case, we're going to look at the type of chemotherapy, the metastases, and body weight. And here's the regression equation. So I'm going to point to this. This part here is just like the multivariate case, the x's and the betas, those covariates. And then the left-hand side of the equation is the logistic piece. So that P is the probability of our positive response. And then again, we have epsilon error term included, and in this case, it will follow a binomial distribution. So here, for our example, the probability of anemia is going to be 1 or 0, whether or not the patient has anemia. The chemotherapy treatments is going to use an indicator variable that will be either 1 or 0 if the patient is receiving a full FOX versus a full FLURI chemotherapy regimen. The other X variable will be 1 or 0, whether or not the patient is metastatic. And then X3 will be a continuous variable that will be the patient's weight at baseline, and baseline's spelled wrong on that slide. So we're going to use the data from the clinical trial the same way we did in multivariate regression and estimate those betas, and then we can come up with some odds ratios. So we throw the data that we collect from our clinical trial into SAS, and out pops an equation, and we get estimates for those betas. So in fact, to convert them to odds ratios, because we're dealing with logarithms, we just need to take e to the power of the beta, and we'll get the logarithm. So you see I've done that for you here for X2 was whether or not the patient was metastatic. Sorry, I forgot. So e to the power 0.5 gives us 1.65, and that is the odds of being anemic for patients who are metastatic relative to those who are not metastatic. And I know that because of the way I define the 1 and the 0. The 0 is the control, the not metastatic piece. Similarly, we can use logistic regression to look at many different variables. We've seen this type of 2x2 table, and you've calculated odds ratios for this type of table. Let's look at how we would do this in logistic regression. So there's the equation, and we have P, the probability of coronary heart disease, and X1 is whether or not the patient has high cholesterol, so a 1 or a 0, and a high blood pressure. So again, we want to get odds ratios with no high cholesterol as the control, or no high blood pressure as the control for the X2 variable. So it's just, it's similar to when we talked about odds ratios in a 2x2 context, in that you need to think about what is being compared to what and how to interpret that. It's the same with logistic regression. And so here's the next slide, shows the result of that regression, and then the odds ratio of having coronary heart disease if you have high cholesterol relative to no high cholesterol. So you can see the odds ratio is pretty high, 2.801. And we can have SAS calculate confidence intervals for those odds ratios as well. So here's a statement: if you have high cholesterol, you're 2.801 times more likely to have coronary heart disease than a patient without high cholesterol. So we can take that odds ratio and put it into a nice sentence. Here's the odds ratio for the high blood pressure, systolic blood pressure. And again, remember that whenever we're dealing with a relative comparison, we want to check whether or not one is inside the confidence interval, and then the interpretation statement that's there. And that's it. So the keys for logistic regression are that you're modeling a binary outcome. You have multiple covariates. You're going to use a binomial distribution to do that. We didn't actually see in these slides how the binomial distribution comes into play, but that has to do with that minimizing and that calculus that I talked about in the multivariate regression case. And then the other key to logistic regression is getting out those odds ratios, which are very useful for interpretation. So make sure you're comfortable with those two aspects of logistic regression. And that's it.